Working with youth in mental health, behavioral health is quite a bit different. Most kiddos, they are still learning and developing, so we're working with a developing brain.
I like working at Missouri Ozarks Community Health because it gives me the opportunity to serve anybody that walks in the door. I serve all ages, and I'm not a registered play therapist, but I will see someone as young as 4 if they are able to express themselves.
A lot of that includes social emotional learning, so teaching kids what feelings are, telling them, appropriate ways to deal with those feelings, teaching different coping strategies, working with them just really to understand and process their emotions in a way that's healthy and productive.
If the child is at school, then they'll, I don't have the issue with the transportation, for example, because they're there.
We have a lot of parents are at work to take off, weekly or even bi-weekly to pick the kiddo up from school, transport them to the clinic site, and then take them back to school. They're really missing a lot of their education in that. School counselors are wonderful, wonderful humans.
They have, things such as scheduling and graduation planning, and they have a lot of other, the testing things. A lot of things go through that counseling office.
Whereas therapy based at the school is more long-term treatment. I work with a treatment plan. Kiddos have goals that they meet inside that treatment plan. And we're focusing on issues that are kind of more long-term. I work with a lot of kiddos and families who have experienced trauma, anxiety disorders, neurodevelopmental disorders like ADHD, autism, a lot of depression, especially with our older youth.
The kids are getting the help they need. And, adolescents especially are so impulsive. I don't want to know how many children have thought about ending their own lives.
Some kiddos require long-term support, so, they might be in treatment for a couple years. A lot of kiddos I can work with between 3 and 6 months.
It gets identified and it gets addressed.
There is a growing need, and so being able to meet that need is very important to Missouri Ozarks. It's important to me, and I'm just glad to be there.